My slides are up. Fantastic. Thanks, everybody. I'm Kathy Pettit. I am with the Urban Institute, and I co-direct the National Neighborhood Indicators Partnership. NNIP, for the Kids Count guests here, is a network that really is focused on helping the communities use data for strategies and investments, so all neighborhoods are places where people can thrive. So we're very excited to make the connection with National Disability Institute through some common friends, and this felt like a really important issue that we wanted to raise up to our network, and I thought the Kids Count folks would think so too, both in the good conversations about data disaggregation, but also on the programmatic side. So we're really happy to have everybody here. Nina, do you want to take the next two slides?
Yes. Hi, everyone. I'm Nina Russell. I'm a researcher here at the Urban Institute, where I contribute to our Disability Equity Policy Initiative. I just wanted to introduce that to you all here today. Urban's Disability Equity Policy Initiative is working on building a body of research just to better equip policymakers, practitioners around the country with rigorous, actionable research that they need to improve the lives of disabled people. And so lately, we've been engaged in a lot of research and policy conversations on issues related to disability measurement, which you'll hear a lot about today during this webinar. And so we're just really focused on growing the expertise of disabled researchers and building research in collaboration with disability advocates to highlight various challenges facing people with disabilities. I included my email here if you would like to reach out to Urban's DEPI team. We call ourselves DEPI for short. But other than that, yeah, I just wanted to say hello, introduce DEPI to you all, and then I can switch to the next slide and walk through the agenda today. So yeah, first we're gonna hear some remarks from the National Disability Institute, and then we're going to go into an overview of implications of data invisibility and financial health for people with disabilities, and then we'll move into solutions to increase disability data visibility, and then we'll go over some opportunities for future work from NDI, and then we will open it up to questions from you all. And then I can introduce Tom.
Great.
Yeah. Great, terrific. Well, first, thanks to Kathy and Nina for the opportunity. Thanks to Urban for inviting us today. We're really excited to be here. Again, my name is Tom Foley. I'm the Executive Director of the National Disability Institute here in Washington, D.C. And, you know, I moved here about 5 years ago for this job. And one of the first things I heard was that if you don't have data, the issue doesn't exist. So thank you to everybody for joining us today about just the importance of disability data. We're really excited to talk with you today. Also, just wanted to share, I'm totally blind. So if I'm completely failing to make eye contact, that's why. And you might hear some noises in the background, which is a screen reader as well. But let's go to the next slide. I'll tell you a little bit more about the National Disability Institute. So we are the first and only national disability organization that works exclusively on issues of asset building, economic empowerment, financial inclusion, financial education. And that's for all people with disabilities. We've been doing this, we're in our 19th year, we're about to have our 20th birthday. And what we do is we build the capacity of the field, sometimes through training, sometimes through technical assistance. We do systems change work by creating replicable models. We test different empowerment strategies to see what works best. But really, all of our work starts with research and data. Again, you know, if you can't measure the problem, people don't pay much attention. Let's go to the next slide. And one of the reasons we work on this is, you know, 35 years ago and a couple of months, the Americans with Disabilities Act was passed. And a piece we don't talk about very much is a piece in there that talks about the proper goals of the legislation. And it talks about equality of opportunity, full participation, independent living, and then the part that really resonates for us, economic self-sufficiency. And, you know, when we talk about financial and economic inclusion, we recognize that when people with disabilities are employed and they're building a better financial future, that's not only good for people with disabilities, but it's good for industry and it's good for the American economy. Let's go to the next slide. I want to introduce my fabulous co-presenters today. First, Ramonia Rochester, who is NDI's Director of Research. Maria Jaramillo, Division Director, Financial Empowerment here at NDI. Yvonne Wright, Co-Director of the LEAD Center here at NDI. Darrell Brown with the Ford, with the Henry Ford. And Brittany Thome, who is a manager here at NDI in our financial empowerment realm. Let's go to the next slide. And Ramonia, I believe I am turning it over to you.
Thank you so much, Tom. Hello, everyone. It's great to meet each of you. Now, as Tom said, you know, data invisibility is equivalent to disability in the shadows. We know it exists, right? We know the needs exist, but our concept of what is required to support people with disabilities is obscured by our limited knowledge, our limited understanding, and overall our inability to apply disability data to policy and programmatic solutions. So a critical part of our mission, not just at NDI, but us as a field, as researchers, academics, policy advocates, and decision makers, and as service providers or practitioners, is to support the development of practical, evidence-based solutions to help people with disabilities define social futures that include financial health and independence. So fostering data visibility is ground zero for removing disability from the shadows and into the mainstream. Now, our next slide talks about a few of the limitations of our current data collection systems. Limitations in disability knowledge overall, as well as in the understanding of the impact of how data is collected, interpreted, and applied, naturally leads to obscurity in disability issues. This has implications for national and local program and policy development, and some of the contributing factors associated with data invisibility include, firstly, a lack of recognition of some disabilities under the ADA, particularly for hidden disabilities, such as mental health, emotional health conditions, for example, epilepsy. Those remain to be protected under the ADA and recognized as disability. Secondly, on our next slide, many organizations continue to use a medical or to employ a medical versus a social approach, which limits the collection and use of disability data. The medical model typically focuses on individual deficit, problems reside within the individual according to that model, and are primarily due to physical or mental impairments versus a social model where disability is a public health issue. As such, under the medical model, data collection hyper-focuses on medical data that's collected in medical settings with an emphasis on diagnoses, treatments, and functional limitations. This limits the scope and the purpose of data collection as it neglects important aspects of social participation, such as the environmental barriers and overall quality of life, which is beyond the scope of healthcare. In contrast, the social model promotes data visibility by focusing on societal barriers and regarding disability as a result of socially rooted challenges, including inaccessible environments, discriminatory attitudes, and the lack of support systems. The social model therefore takes a broader approach to data, and to data collection, which looks at information about accessibility, inclusion and discrimination, quality of life, and participation in various aspects of society. This social focus also means that data collected through the social lens can highlight systemic inequalities and fuel advocacy efforts aimed at removing barriers and promoting social change. On the next slide, we highlight the third issue, which involves a lack of coherence in measures and definitions across various reporting entities and systems. Different entities collect data on different factors, and they also report different types of disability data. And this can lead to, or this does lead to, obscurity in disability. As you know, there have been many attempts to, or as you may know, there have been many attempts to standardize disability data collection via the two most widely used question sets, which is the Washington Group Short Set, which measures functional limitations on a 4-point Likert scale. And then according to the American Community Survey, or the ACS-6, which has a binary scale and measures disability across 6 indicators. If you look at the statistics to the right of your screen, however, you'll notice that despite both the ACS and CDC surveys using the same question set, which is the ACS-6, there is vast disparity in their statistical estimates. For the ACS, disability is 13.6% versus the CDC data set, which estimates disability to be at 28.7%. Other national surveys also use the ACS-6, but again, data within most of these surveys is obscured. Some of these include the American Housing Survey. In tandem, and very importantly, disability measures used in the ACS-6 are incongruous with disability definitions in health legislation. Current health legislation offers a broader scope for conceptualizing disability. This, of course, leads to underreporting, or the ACS-6 being incongruous with these legislations leads to underreporting of statistics, which has implications for funding and resource allocation at the policy level. On the next slide, we briefly discuss some of the reasons for underreporting, including a fear of stigma and discrimination that leads to individuals living with disability failing to disclose that they actually have a disability. And of course, their failure to disclose leads to limited access to resources. Another reason is a failure to count people, or those whose disabilities are episodic or mitigated, for example, by assistive technology or medications, or in some cases where their disabilities are in remission. This is despite the fact that the American, or the ADA, the American with Disabilities Act, stipulates that these data reporting systems need to count people with conditions that are episodic. If you look at the Washington Group set, for example, they only count those with the most severe disability or functional limitations. A study done by Jean Hall and her colleagues at the University of Kansas Institute for Health and Disability Policy Studies stated that the ACS undercounted people with disabilities by 40% in 2022. They also tested the Washington Group set and found that this system demonstrated a 40% reduction in the US disability rate because it excludes people with these mitigated disabilities, or only included people who, excluded people who reported only some difficulty across any of the 6 areas of functioning. Importantly, the researchers also found that a single broad disability question captured 11.2% more people than the ACS set alone. This has implications for even our current attempts to achieve uniformity across data collection systems. And on our next slide, this data obscurity perpetuates a cycle of people with disabilities being unseen and underserved. A lack of accurate, reliable, and accessible data about certain populations or issues significantly impacts national policy and program development in several ways. Data invisibility perpetuates a cycle where problems remain unseen, policies are ineffective, and vulnerable populations remain underserved. Data invisibility limits evidence-based policymaking, as without adequate data, policymakers struggle to understand the scope and the nature of problems, leading to ineffective or misguided policies. In tandem, data gaps make it difficult to evaluate the effectiveness of existing programs and policies, making it challenging to learn from past experiences and improve future interventions. And of course, inevitably, this leads to inequity and exclusion, where data invisibility often disproportionately affects marginalized and vulnerable populations such as low-income groups, minorities, or those lacking internet access. Policies based on incomplete or aggregated data can perpetuate stereotypes or neglect the specific needs of diverse communities, leading to unfair resource allocation and unequal opportunities. The cycle continues to impair public transparency and accountability, of course, as without transparent data, it becomes difficult for citizens, researchers, and civil society organizations to understand government decisions and ensure the policies actually serve the public interest. And this poses ongoing challenges for program evaluation and funding. Lack of relevant data is challenging or makes it challenging to evaluate program effectiveness, hindering the ability to justify continued funding or advocate for expansions in funding. For example, without demonstrating the positive impact of safety net programs, it's harder to make a case for their continuation or critical reforms for their expansion. Ultimately, a lack of data transparency erodes public trust in the veracity of public programs as well as in scientific information. I'll now turn over to Maria, who will talk briefly about the financial health and data gaps that we see.
Thank you, Ramonia. We can please go to the next slide. So as Ramonia has shared, we see significant gaps in financial health for people with disabilities. And we see this across income, employment, and access to financial services. And as we have been sharing, the data is often sparse or inconclusive. Next slide, please. While economic data exists across several surveys, most economic analysis focus on one single point, or one single cost of disability, which is the paid labor earnings penalty. We define this as how much a person's earnings go towards addressing the needs of living with a disability. The calculations are usually based on the total labor earning and hours worked. So in addition, financial costs of disability are difficult to measure and are understudied. These include additional expenses such as medical, the cost of unpaid care, and the unpaid household labor penalty, which is the cost of an adult in the household not being able to work due to disability. So this economic analysis also failed to capture intersectional components of financial costs, such as gendered and racial gaps, including the gender wage gap. Next slide, please. And even though there is a safety net that supports people with disabilities, many means-tested public benefit programs in the US impose asset and income limits, but do not take into consideration the additional cost of living with a disability. The result is that many people with disabilities may be viewed as financially stable and are therefore denied assistance, even though the reality of their extra disability-related expenses places them in a tenuous financial position. A key study carried out by NDI shows that households containing an adult with a work disability require on average 29% more income, or an additional $23,376 a year at the median household income, just to obtain the same standard of living as a comparable household without a member with a disability. Next slide, please. National surveys and indices also fail to adequately capture the realities of gaps in financial well-being among people with disabilities. For example, the FINBRA National Financial Capability Study did not include the disability question in the survey for some time. Then in 2024, they included it. The challenge was that the approach they used obscured data capture. Specifically, the response set conflates permanently sick with disabled and unable to work. This eliminates subsections of the disability population, for example, those who are permanently disabled but are able to work. The report also does not include any disaggregation of disability data. The second example here is the FDIC survey of household use of banking and financial services. This survey does provide a high-level disability data disaggregation and a disability data dashboard for more granular data. However, the sample size for Asian Americans is small, and this is also the case for Native American, Native Hawaiian, or other Pacific Islander households with a disability, which we know have some of the highest rates of disability. Next slide. And in this final slide for the section, I'll talk about two additional examples of how data invisibility impedes our ability to address critical concerns for people with disabilities. The first is transportation access. Transportation access remains a key consideration for defining the evidence base for disability services. So the first example here is the 2022 National Household Travel Survey, which defines a travel limiting disability as a temporary or permanent condition or handicap that makes it difficult to travel outside of the home. The first challenge with this survey is how disability is defined, which may work to obscure data disclosure. Many individuals with disabilities do not consider themselves to have a handicap or condition. Then the second challenge is that survey data is limited, as it reports travel activity on the day the survey was carried out and doesn't take into account aggregate travel activity over a period. And then digital equity remains a key concern for many households with disability. The Federal Communications Commission, FCC, has a great data visualization tool. However, there is no breakdown available for the population with disabilities. Thank you. I'll pass it back to you, Ramoni.
Thanks, Maria. And I'll briefly share some of the issues we found regarding the data around children and youth with disabilities. On the next slide, we discussed earlier how disability is defined obscures the numbers or determines what's reported and ultimately what is funded in policy. And if you look at this brief example, the ACS survey for 2023 said or stated that or reported that 3.5 million children have disabilities, which was 6.8% of the population. And additionally said that about 3.3 million are 5 to 17 years old. For that same year, the National Survey of Children's Health reported that just under 15 million children have special healthcare needs, which is a vastly different number from that 3.5 million. However, it does note that 4 million have functional limitations, which is closer to the 3.3 And then that 3.1 million have of those children are 6 to 17 years old. Now, if you look at the Kids Count data, which also uses the ACS as their system of, or their measure, they said that 15.6 million children have one or more emotional, behavioral, or developmental conditions, and that all 15.6 million of those children were 3 to 17 years old. Each of those surveys considers or defines functional disability as one that lasts more than 12 months. However, depending on who decides which numbers to use in policymaking, you can see where there might be challenges. And if you move to the next slide, data invisibility impacts policy programs and outcomes for youth and children with disabilities. Inconsistent data results and it makes it difficult to identify specific needs and challenges for this population. A lack of accurate data leads to challenges developing effective interventions and support services. And then these data gaps exacerbate disparities to access to quality services for the different groups of youth and children with disabilities. Ultimately, limited data and inadequate support results in poor outcomes for youth with disabilities, including lower rates of education and employment and lower rates of financial independence. On the next slide, we talk specifically about the transition age youth population, which most systems defined as youth between ages 15 to 24. But as we saw before, the above measures are often inconsistent, and how measures are interpreted are also often inconsistent. In addition, where transition age youth are concerned, a lack of collaboration between agencies and stakeholders results in fragmented data collection and reporting. Underrepresentation of certain groups in data, for example, youth with disabilities in foster care, compounded by a lack of standardized data collection practices, makes it challenging to aggregate and compare data across different settings. The result is limited data with which to inform specific needs regarding transition age youth. However, there are solutions, and our next slides share a little bit about what those solutions look like. Firstly, data visibility begins with data culture reform. Addressing data invisibility requires a commitment to data collection, disaggregation, transparency, and accessibility, along with fostering a data-driven culture to ensure that national policies and local programs are built on a foundation of sound evidence and meet the needs of all citizens, including individuals with disabilities. In our experience, particularly at the organizational level, developing a data-driven culture has been one of the most challenging areas in our practice. And of course, this is the area from which all other changes flow. This is because developing and implementing a data culture or data cultural reforms is often timely, time-intensive, and can be quite disruptive. Nonetheless, it's important. Creating data visibility for youth and others involves standardized data collection, which includes developing and implementing standardized procedures for collection methods across agencies and jurisdictions. Improved data integration is another area that we need to work on, which includes integrating data from different systems, for example, data from education with data from healthcare and social services to develop a more comprehensive picture of disability needs. Also, targeted data collection that looks or has targeted efforts toward specific populations and addressing the needs or existing gaps within that population data. On our next slide, we talk about enhanced collaboration and the need to strengthen collaboration and communication among agencies and stakeholders in order to improve data sharing and data coordination. And then, of course, data-driven decision-making. We need to use data as a basis for informing policy and practice toward more effective interventions and support systems with people with disability. On our next slide, NDI seeks to amplify disability data, particularly financial health data, through various initiatives. We currently work to disaggregate and report data from the Financial Industry Regulation Authority, the FINRA Financial Capability Study, as well as the FDIC survey of household use of banking and financial services. We also continuously engage in collaborative partnerships and consultations with economists and financial health agencies and projects, including the Asset Funders Network, and as you will hear later, the Henry Ford. We also engage in other special interest projects and funded research projects toward creating data visibility, as well as through our role as a quasi-disability data repository for several institutions and partners, and through our training and technical assistance initiative, where we are a resource partner for many federal, state, and local agencies. Yvonne will now speak briefly about one of those projects I referenced earlier.
Thank you so much, Ramonia, and hello, everyone. And thanks for the opportunity to just share with you how my role as a director of projects has helped me, how data has, by using data, how that's helped me lay the foundation for partnership and collaboration for a project, and also help drive the services that we're providing in that project. So if you want to go to the next slide. I'm going to share a little bit about our STEM apprenticeship project that we have going on in the state of Missouri. I think it's important to highlight that this is a collaboration between NDI and the Missouri Department of Higher Education and Workforce Development, where the Missouri Office of Apprenticeship is located within the state. So this will tell a quick story about how we use data to start our project and how it's going. So if you want to go to the next slide. So we utilized apprenticeship data that exists through RAPIDS, which is the Registered Apprenticeship Partners Information Data System. And in Missouri, we looked at the active apprentices that have identified the engagement rate of people with disabilities who are active apprentices in Missouri. And as you can see, that number is 3.18%, which frankly is higher than the national average of 1.21%. However, that is still a significantly low number. We focused upon that data to say, hey, do we have something that we can really focus on to hopefully make a difference? The other aspects of the data are that it showed us that few apprentices are reporting as having a disability. And of course, that could speak to even whether or not the person is participating, but maybe has not disclosed that they have a disability. So that was another opportunity for technical assistance and collaboration. While some RAPIDS data is broken down by age groupings, it is really not specific enough to youth to allow us to be able to track what we need to do. So it opened up the realization that it was a missed opportunity to engage that talent. And as I mentioned, that state partnership revealed this critical visibility gap. So on the next slide, I just wanted to give you an idea of this project is currently underway and has been going on since the beginning of the year. we utilized that data to set a foundation for collaboration in Missouri with our Office of Apprenticeship Partners. And it really has helped define the services for that collaboration. And so what we're doing in Missouri is we are reaching out and we are with this collaboration and many other partners in the apprenticeship ecosystem. We are engaging youth and families in many different ways. We are conducting outreach. We are attending events where youth with disabilities are, and we're really educating and giving information about STEM jobs and how apprenticeships can be that avenue for entry-level employment, but also for a career pathway. We're telling stories. We're using videographers to tell stories about people already working in STEM apprenticeship positions, so that other youth with disabilities can really see that, really trying to impact that data through the activities that we're doing in this project. We've built an incredible amount of partnerships with schools, apprenticeships, and other workforce staff, workforce development staff, as well as employers. And we have worked hard to highlight those promising practices by really getting out and telling the story, but also providing technical assistance as we move along the lines of disclosure, along the lines of making sure that the right partners are at the table to make sure that that avenue exists for a youth to be able to access apprenticeship services. So the goal of this program is that we focus on clear, visible, and equitable STEM pathways for youth with disabilities. And we're really proud of this project. And I have to say that data really helped us start the project and know where to move with it. So thank you, and I'll turn it over to our other presenters.
Hi, good afternoon, everyone. Again, my name is Brittany Tome, and I'm with NDI. And I'm really excited today to share how NDI and the Detroit Alliance for Access and Assets, along with the Henry Ford, really leveraged data to visually highlight the lived experiences of people with disabilities, especially those at the intersection of race, ethnicity, and poverty, as well as offered resources at the same time to meet the needs of those individuals, or at least the access to those resources and knowledge of them. So just a little bit about the Alliance. National Disability Institute supported the development of the Detroit Alliance for Access to Assets. It's now locally led by Wayne Metro Community Action Agency and has over 75 partners from the Detroit area, and those include community partners from a variety of key stakeholders. And it was truly formed to bridge disability, racial equity, and economic inclusion across Detroit. And that was done because we recognized that BIPOC persons with disabilities face some really distinct systemic barriers to financial stability. And so the goal of the Alliance is to really work on fostering dialogue, breaking down the silos to financial stability, and building collaboration among disability service partners, financial empowerment groups, and organizations that serve communities of color and racial equity. So when these groups came together, all these different partners, one of the clearest needs that emerged was that there was fragmentation of local resources. And the Alliance said we really need a clearer picture of resources in our community to meet those complex needs of BIPOC persons with disabilities so that they can address those barriers. So we came together, we called it our 313 Day. 313 is Detroit's area code. And we hosted a community resource mapping event. And together, Detroit-based community providers and key stakeholders had the opportunity to network and build connections, but also identified all the different resources that they were aware of in the Detroit area that could help residents overcome financial barriers. And we broke that down across 6 key strategies and categories. And the first was public benefits and community services. So things like transportation, housing, food, those stabilizing supports. And then employment or self-employment, ways to grow your income. Once you get income, you need to file taxes. So, where are the resources for free tax prep and EITC so that you can support families once income is earned? Then where are the resources for financial education and counseling was another key strategy. That knowledge of how to manage your money. And then the final key category was asset development and wealth building. I'm sorry, the second to last one is asset development and wealth building to create long-term stability and wealth accumulation. And then finally, the last one was advocacy and equity. So if someone is experiencing a barrier like discrimination or language access or accommodations or something like that, that they haven't been able to advocate for, making sure that they have the resources to be able to do that. And the result was the Detroit Alliance resource mapping tool. And I'm going to put a couple of links in the chat so you will absolutely be able to take a look at these. And this tool was really a way that we used all of the data accumulated for community partners and residents to explore neighborhood resources and respond to those complex economic challenges that were faced by individuals with disabilities, especially those in communities of color. It really is more than a map. It's really a reflection of community-centered design and also community-sustained design. And it uses data to visualize the layered realities that people with disabilities and intersecting identities face. And it also empowers individuals and providers to find and deliver those services locally, where an individual is living in their own community. And then it also can help guide investment and development by showing and creating policy level change by really showing where gaps are and opportunities exist in a very visual way. This is a living map. It's fed by the community partners and sustained by the community partners. And it's also something that the Alliance is working to expand. So we're working to expand it not only within Detroit, but now kind of extending it out beyond Detroit. So it's a great example of something that can be replicated. And I'm not going to keep talking about the map. I'm going to turn it over to Jarrell so he can show you the map and show you some examples of how the community can use the map. And I will turn it over to Jarrell, and he's going to walk us through those examples and see how it comes alive visually.
Jarrell, you need to unmute. Or I can unmute you if. I think you're still muted. 1 second. Let's see if I can. It looks like you're unmuted. Let me try to elevate you and see if this helps. Just made you a co-host. See if that will work.
Can you hear me now?
Oh, yes. Great.
Yes.
Perfect. And also I am going to share my screen, but thank you, Brittany, for the awesome summary of what this tool was. And we were definitely honored to be able to participate on 313 Day to support our local Metro Detroit area. If you're not familiar with the Henry Ford in Metro Detroit, we're a cultural institution and museum that garners about 2 million people a year in visitation and has several community outreach external programs that support communities with disabilities, communities of education, communities of innovation, and so on. If you have a chance, please feel free to come out and visit. But we did meet on 313 Day. We met with the team, we had introductions, we networked, and we began mapping all of the resources and categories that Brittany was mentioning. There's a lot of Post-its here, so thankful to the NDI team for cleaning this up. But it really helped us categorize and understand what the community wanted and needed, hence resulting in a Detroit Alliance for Access and Assets resource mapping tool. Within this tool, we have first mapped all the post-its that you see on the screen or that you saw in the video prior. We then categorize them in a legend here, which allows someone to understand how many resources are outside of Metro Detroit and how many resources and what type are inside of Metro Detroit. We'll go through the tutorial section here briefly and then some use cases, but essentially we've mapped the resources through a data collection process, and we've also mapped a lot of the data, and all of the data our partners communicated. Similar to what Ramonio was saying, there is a lot of data out there, and without data, it's hard to have that conversation and validate reasons for funding, resources, and development. So this tool lets you turn on and off certain data sets, certain categories if you're only focused on asset, free tax preparation, but it also aligns and brings in Chase Bank data, which was a partner in this process. So if there's bank locations, financial locations, and things like that that help certain communities, we wanted to be able to map that. And so what we do at the Henry Ford is map data and make data as accessible as possible so that we can better serve the communities we live, work, and travel through. We bring in public data as it relates to routes because that was identified as something from our community partners who attended the 313 Day, bus stops, opportunity zones, neighborhood revitalization areas, but then also the data, health and wellness data about disability access, so that as you're looking at these resources on the map, you're also getting the data behind it. So where is the highest percentage of disability status at the track level, which is similar to blocks, and when is it least? We know Metro Detroit pretty well, and these pockets make sense as it relates to disability accessibility, disability by race, disability by poverty status. All of these things show the inequities or the accessible barriers for financial empowerment for communities facing disabilities. Now, this is a sustainable tool. We've brought in a survey where you can add or update the data that you see by clicking. So that creates a tool that we want to sustain and keep going moving forward. Lastly, we can look at address. So as someone is migrating or looking at a certain community, this is based on a Google Map database where we can look up certain locations where our community partners, this is actually where we met, and we can look at the resources from 5 miles to 100 miles and then get all of the partners and all of the things and resources that were identified as bridging the gap to financial empowerment.
That's great. Thanks very much. I think I will share my screen again and go back to Maria, and that link is in the chat.
Thank you, Kathy. Since we're running out of time, we're going to skip my slides and just mention that in the resource section, we have a description of future projects NDI has been working on. So please feel free to check them out. This is the initiative that Brittany and Jarrell just spoke about. We work with communities to empower them to be more disability inclusive. We provide strategic assistance and training for scaling and broader impact. And we also empower what we're calling local change makers for disability inclusive systemic impact. Next slide. And I won't go in detail on the other initiatives, but we have a key landmark initiative in which we've been training more than 80 financial counselors and coaches to serve clients with disabilities. So I'll leave it there, and I think we want to open it for Q&A. And more information on our initiatives in the resource section, so we can find ways to collaborate and support your work. Thank you.
Thank you so much. So much information. Let me, I will stop sharing for a minute. If folks have questions, they could raise their hands or just come off of mute. It's not that big of a group. Other data questions some folks had, I know, in the when they registered.
I had a question about the slide about the different estimates of children and youth with disabilities. Because I was confused, like it seemed like the first two columns were using a similar age group at the bottom, where the 6 to 17-year-olds, but then like the kids count was, you know, using younger kids. So I don't know if we can go back to the slide, or if it just, I was confused because it mostly the middle column, because the National Children's Health Survey is the one that I'm from, the Children's Trust, and we collect disability data on all, we expect all the programs we fund, which is, you know, $260 million or so in services in our Miami-Dade County. We expect them all to be inclusive, fully inclusive programs, and we collect a lot of information about the participants so that we can track that and make sure that programs are serving kids of all abilities. And we modeled a lot of our questions on the National Survey of Children's Health, like, does your child have a condition expected to last longer than a year that makes it harder to do things that same age peers can do, kind of thing. And so what I was confused about is that the 15 million, right? Because that's why we went with the broader, because obviously the ACS is very limited. But then how does it get down to the only 3 million or 6 to 17? If 15 million, so where are the other 12 million? They're all under 6?
And
Thank you for your
tricky question, I know.
I'll take that question, Lori. So this was more to illustrate, oh, the slide has disappeared from me. This was more to illustrate how disability is conceptualized across the different instruments.
Yeah.
So the ACS in general typically has more conservative estimates of everything in general and across the board.
Right.
It's the census. And yes, the National Survey of Children's Health is typically the measure that most organizations use. However, within the National Survey of Children's Health, there are different levels of screening. So that broad 15 million number is all the children who have special healthcare needs. These children fall across the spectrum with regard to ages, the households they come from, the poverty and income levels within those households, and so on. These children all have some type of special healthcare condition. However, when it comes to assessing who qualifies for public benefits, that's not necessarily the statistic that is used. What is typically used is, especially with regard to disability, or specifically with regard to disability, is the number of children who have functional limitations. And that you can see is a vastly lower number. So if you're looking at the number of children who would qualify for IDA services, for example,
Right.
it would be more in line with the 15 million,
Okay.
depending on, you know, who the number that are in schools. But if you're looking at how many would actually qualify for disability benefits based on functional limitations, then that would be the 4 million.
Okay, so that's so the 3.1 is of the 4 million.
that's of the 4 million.
Okay, that's why I think I skipped over that. I was like, how did the 15 get down to 3.1? But it's because it's the 4. Okay, that's helpful. Yeah.
And
thank
just to clarify, that 3.1 million, based on how they report their data, just on their dashboard, they have categories for 6 to 17, which was the most readily accessible from the dashboard.
Right.
And then I think there's one more question in the that we can, if I'm sure that's also not a brief answer, but if people have if you have any comments on any sort of consensus building around definitions before we turn to Elizabeth to close us out.
I can read the question. It says, has there been any efforts to streamline the definition of disability so analysis can be more consistent across different agencies?
There have been efforts. However, those efforts have not been as successful as we'd like. Tom is smiling broadly. Do you want to take this one, Tom?
And not necessarily.
Okay.
Yeah, there have been a number of different efforts to try to come up with something a little bit more consistent, but it seems like when those efforts have been attempted, they quite often leave out large swaths of the community and also undercount. So Ramonia, you're more of an expert on research than I am, but if there's anything you want to add, please feel free.
And of course, the most recent debate, Tom and everyone, is around the ACS, right? Those 6 standard questions. And essentially, the changes that were proposed in the last iteration of an attempt to make the system more uniformed, even more uniformed, would have undercounted significantly, maybe by 40% the number of individuals with disabilities across the US.
Yeah, we can definitely send on the thank you notes and blogs, and I'm sure you guys have information and links on that too.
Yes.
All right, maybe turn it over to Elizabeth to say.
Absolutely.
Thank you so much.
Well, I want to be very thoughtful of time, so I want to close us out by giving our thanks to Urban and to each of you for joining. As you're signing off, or if you're listening, we want you to know that our goal today was to pique your curiosity. We hope that this helped you to think about what's going on with disability data. How is that impacting the work that I do or the work of my organization? Is there a critical element of impact that we are perhaps not able to lean into because of the way that the data presents itself? We are a very warm, inviting group. We would love to have the opportunity to chat with you more about this in collaboration with Urban and the team there, so that we can support you in not just uncovering what is within what you're doing, but what could be in regards to positive outcomes for people with disabilities. We always know that people come to the table with the very best intention, but may not have the best data. And so we will meet you there and very much look forward to having the chance to communicate with you, engage with you, and partner with you. Thank you all so much.
Thanks to all the presenters today. There was great sets of information. And there's even a very rich set of resource slides they put together too, beyond what these slides shared. So we are very grateful to have these sort of experts. And for the NNIP folks, we'll have Ramonia and Elizabeth, I think, are the 2 folks joining us in Charlotte in a couple of weeks. So you'll have more time to talk with them. And we'll also be sharing, as our partners share more information with us, we can share local examples back with them. So please keep the conversation going. And if you have other topics you'd like to hear about, send me a note after. We'll send a thank you note, and we can definitely explore future webinars also. So thanks, everybody. And I will hope you have an awesome afternoon.
Thank you. Take care.